It's a pleasure to be here. It's a special pleasure to see so many business leaders in the audience, because I want to try to explore the case for putting on the agenda not only the kind of programs we've been talking about, early education programs, visitation programs, but to also put on the agenda income transfer programs. To what extent can an economic case be made for income transfer programs? We heard this morning this is a dead issue whenever you try to talk about it, but I think if you look at recent policy enactments, you have sources of inspiration. The Earned Income Tax Credit, for example, has been around for about 20 years, expanded dramatically. It's now about $35 billion. It's much bigger than cash transfers that we make through our TANF system. It has bipartisan support, and it's been a very effective way of transferring income to low-income families who are working. We enacted a child tax credit. We didn't make it refundable, which would target it more toward low-income families. But we have made policy strides in the direction of income transfers. So I want to talk about some research in which we've tried to estimate what the benefits of these income transfers might be for children, long-run benefits for children, in the same way that we've calculated benefits for programs like early education and home visitation programs. David Brooks last night gave dramatic accounts of programs that introduced the first book into homes. I want you to think instead, for much of this talk, not to that kind of family, but rather to the working poor. 6 million children now live in households with incomes below the poverty line, but where at least one parent was working full-time. 6 million children living in these families, income below the poverty line. So what would be the benefits for them? It's not the case that the mothers don't know there are benefits from having books in the home and reading to their children. It's not the case that they don't know that child care quality is important. They just can't afford it. It's not that they don't know health care is important. They have a job and sometimes they can't get affordable health insurance. So to what extent would income enhancements benefit the children and the families, both in the short term and the long term? So here's the question I want to focus on. What would be the economic benefits, the long-run economic benefits of a policy that brought poor children's prenatal to age 5 family incomes up to the poverty line but made no other changes? Right? That policy in and of itself. The kind of benefits that we might look to are the same kind of benefits that we track when we evaluate early childhood education and home visitation programs. In childhood, it's things like preventing grade failure, special education. If you think about the kind of economic benefits to taxpayers that result from preventing a child from having to repeat a grade, from preventing a child from having to go into special education, there are thousands and thousands of dollars that are spent per child every time those things happen. So to the extent that we have programs that can prevent these kind of things, it's a real benefit to taxpayers. Better health, less crime, fewer non-marital births. But we can also look directly to productivity issues. If you believe that adult earnings are a measure of productivity, we can look at impacts of early education programs as well as income transfers on outcomes like earnings, as well as mental and physical health. Our study is really the first to be able to link poverty in early childhood, this prenatal to age 5 period, to adult outcomes, focusing primarily on earnings and health. The information that we use for the research came from a study called the Panel Study of Income Dynamics. I worked on this study for 23 years of my life before I went to Northwestern. It's a national representative sample of 5,000 families begun in 1968. Every adult and child in those families have been followed every year since 1968. So we have up to 35 years of data beginning in the prenatal year for about 1,000 children all around the country, representative children around the country, with which we can track links between early childhood economic conditions and now adult outcomes, where the adult outcomes are measured for the most part between ages 25 and 30. So let me start with just some simple comparisons. I don't want to imply that these are the actual causal impacts of poverty. These are just the associations. So how do kids who spend the prenatal year to age 5 in families with incomes below the poverty line compare with children who spend that period with incomes somewhat above the poverty line, between the poverty line itself, which is about $15,500 for a family of 3. All right, so if the income averaged below $15,500, that child would be considered poor. If it was between $15,000 and $30,000, they would be between the 1 and 2 times the poverty line. Above $30,000, it would be more than twice the poverty line. So simple comparisons. If you look later at how much school they completed, you find about 2.5 more years of completed schooling for kids whose income was at least twice the poverty line compared to kids whose income was below. That's the 11.7 versus 14.1. If you look at earnings, so we track earnings between ages 25 and about 35 actually, and if you look at average earnings, inflation adjusted, you get almost a 2-to-1 difference, with kids growing up in poverty averaging about $20,000 versus $37,000. Physical health, mental health is worse, as you might expect, for kids who are poor. Crime differences show up, and particularly striking are these differences in non-marital teen births. 54.3% of women who were poor in early childhood have a non-marital teen birth, compared with only 8.7% of women who grew up in families with incomes at least twice the poverty line. So these are the kinds of outcomes that we're looking for. And I don't want to bore you with the details of how we went about trying to estimate not just an association, but an actual causal impact of early poverty. We did this by trying to adjust for as many correlated factors as we possibly could. And the most notable kind of adjustment that we made was to adjust for what the incomes were after age 5. So controlling for what the family income was between ages 5 and 15 to be linked to these various outcomes that we looked at.